I'm Dr Michael Yunaev. I'm a Sydney-based oncoplastic breast, general and cosmetic surgeon. I'm also a principal surgeon at Breast and Body Clinic. We have a number of clinics across Sydney and New South Wales and would love to see you here. A breast lift operation is designed to reshape the breast envelope. It is very common for particularly mums to have gone through pregnancy and breastfeeding, and for the breasts to go through a significant change in that period of time. They may increase in size dramatically. Sometimes they can get smaller, although that's less common. And then after the breastfeeding and the pregnancy is completed, the breast may revert back to its original size. But unfortunately, the skin envelope has been stretched in many cases, and what you end up with is aptotic breast. Ptosis means droopiness. In some patients, the nipple is not affected, and there's just general skin drooping. But in other patients, the nipple itself is also affected. When the volume is reasonable and they don't want to necessarily change the volume, but when they really are only concerned about the position of the nipples themselves, so the droopiness of the breast. A breast lift is a great technique to reshape the skin envelope and to put things where they used to be. Look, other common scenarios include patients who've had weight loss. So when you lose that weight, often that skin has been stretched quite significantly, and then the breast, it reverts back to more perhaps its original size, but the skin is no longer able to do that. Another common, or perhaps not so common condition is tuberous breasts. This is a congenital condition where a patient is born with certain constricting fibers around the breast. So in this case, breasts often develop quite asymmetrically, but also they grow quite differently to what a natural or normal breast will grow like. This can result in very droopy looking breasts associated with other abnormalities in that particular condition. There are three main incisions that are used by surgeons for breast lift procedure. The smallest one, and this is for patients who require only a very minor lift, an incision around the areola, allows you to perhaps lift things by about 1 to 2 centimeters at the most. Most patients, however, will need a more dramatic procedure, which will include either an extension vertically from that circular incision, or sometimes an addition of a horizontal incision as well in the inframammary crease underneath the breast. The best results and the most long-lasting results are achieved by what we call an anchor type incision. This is where you have the areola incision, the vertical, and an inframammary crease. And I guess that's what's really important to a patient, because that's what a patient sees, the scars on their breast. But one important note to make here is that the patients themselves, the women that have this procedure, are in fact not able to see most of the scars because they are hidden away underneath the breast. Normally wouldn't see all of those incisions, which actually fade really well and become much less noticeable after the first 12 months. A breast implant can certainly be used in conjunction with a breast lift or alone. We can actually achieve a breast lift with implants alone without any incisions. It is important to do your research to make sure that you have the right surgeon for the job, and that what you would like to get out of the procedure is also where the surgeon is at. Breast lift surgery, is it painful? Well, in fact, it's not. There is some associated discomfort, much less than with any other type of surgery that we do. Get back to normal activity pretty much straight away.